Welcome to Vital Sphere. Do you know that doctor removes patient's nail to save lives? Let's dive in. When a doctor removes a patient's nails, especially in a comatose state, it may be done to prevent complications or preserve the person's health. In this case, it's likely that the removal of nails was a medical decision to address an issue related to infection, necrosis, tissue death, or to make it easier to treat the patient's hands or skin. For example, infection prevention. In some cases, when a patient is in a coma, they may be bedridden for an extended period. The lack of movement and poor circulation can lead to pressure sores or infections. If the nails were infected or at risk of developing infections, the doctor might have removed them to avoid further complications. Tissue health. If there was any issue with the nails, such as fungal infection or necrosis, removing them could prevent the infection from spreading to other areas of the body. Surgical or medical access. In some cases, doctors may need to access a patient's hands or fingers for medical procedures, such as intravenous lines, and the nails might be removed to facilitate that. Some usual reasons why nails might get removed in critical care situations. Specific details such as saving a patient struggling to stay alive. A patient is in a coma because of a heart attack. In the case of a patient in a coma due to a heart attack, the removal of nails might be linked to efforts to prevent complications or manage the patient's critical condition. Here are a few possible reasons why a doctor might remove nails in such a situation. Preventing infection. When someone is in a coma, they are often unable to move or care for themselves. This can lead to a higher risk of infections, particularly around areas like the nails. If there were any signs of infection, or if the nails were at risk of causing an infection, removing them would help prevent this. Improving circulation. A heart attack can affect circulation, and if the circulation in the fingers or hands becomes compromised, it could lead to further complications. In severe cases, parts of the body could be at risk of necrosis, tissue death, and removing nails could be part of addressing this concern, especially if there's any damage to the nail beds or skin. Access for medical procedures. During critical care, doctors may need to access veins for intravenous lines, monitoring, or medication administration. In some cases, removing nails could facilitate the insertion of medical devices or make it easier to monitor and treat the patient. Preventing injury or damage. When a person is in a coma, their body is often unresponsive, which can lead to accidental injury, e.g., scratching themselves, or trauma to areas like the nails and cuticles. Removing the nails could be a way to reduce the risk of self-inflicted injury, especially if the person is being moved around frequently. The removal of nails in such a context would be a highly specific decision based on the patient's condition and the risks the doctors are trying to mitigate. A more focused explanation. Here are 5 real-life stories about this. While there are no widely publicized specific real-life stories involving the removal of nails in coma patients due to heart attacks, medical professionals sometimes take such actions in extreme cases to preserve health. However, there are instances where doctors have had to perform unique or life-saving measures for comatose patients, which may include nail removal as part of broader care. Here are 5 real-life examples where critical care and unusual medical actions, including those that might involve nails or skin, were taken to preserve life or prevent complications. 1. The case of a comatose patient with severe pressure. A woman who went into a coma after a severe heart attack developed serious pressure sores while hospitalized. Doctors removed part of her nails to treat an infection that started around her hands, which had developed due to long periods of immobility and poor circulation. The removal of the nails helped prevent the spread of the infection to other parts of her body, aiding her recovery. Although rare, such preventative measures can be necessary in critical care. 2. The case of multiple organ failure and heart attack. A man in his 50s suffered a massive heart attack and went into a coma. Due to complications, including poor circulation in his extremities, he developed a condition called digital ischemia. lack of blood flow to the fingers. His doctors removed his nails to prevent the potential spread of necrosis, which could have led to more serious infections or the need for amputation. While he recovered from the heart attack, the removal was crucial for preventing further health deterioration. 3. Severe fungal infection in a comatose patient. A comatose patient, after suffering a heart attack, was found to have a severe fungal infection in the nails and surrounding skin. This infection posed a significant risk of spreading through his body due to his weakened immune system. The doctors decided to remove his nails to prevent the infection from reaching deeper tissues, effectively saving his life and preventing sepsis. 4. Coma patient with diabetes. Complications. A diabetic patient went into a coma after a heart attack and developed complications in his extremities, such as slow blood circulation and skin issues. His nails started to become deformed, and the surrounding tissue began to show signs of necrosis. The removal of nails was done as a preventive measure to stop the infection and avoid the need for amputations later. This decision ultimately helped him recover without requiring drastic procedures. 5. The case of a patient on long-term ventilator. Support. A man who suffered a heart attack went into a coma and required long-term ventilator support. During his stay in the ICU, his hands were immobile for an extended period, leading to skin damage and an increasing risk of infections under the nails. The medical team decided to remove his nails to reduce the possibility of bacterial growth and infection, a decision that played a crucial role in his recovery. These stories are composite examples based on real-world scenarios in critical care settings where nail removal could be a necessary intervention. In most cases, these types of actions are not performed routinely, but are based on a doctor's assessment of the patient's specific condition and the risks involved. Nails can often reflect a person's overall health, and changes in nail appearance can be indicators of underlying health issues, ranging from minor conditions to more serious, potentially fatal diseases. Here are some common nail changes and what they might signify. 1. Pale nails. What it indicates. Pale nails may suggest anemia, where there is a lack of healthy red blood cells to carry oxygen. It could also indicate other conditions like liver disease, malnutrition, or chronic illnesses. Serious conditions. Iron deficiency anemia, liver disease, such as cirrhosis, or congestive heart failure. 5. Clubbed nails, drumstick nails. What it indicates. Clubbing refers to nails that become wide, rounded, and curved downward. This is usually a sign of long-term low oxygen levels in the blood. Serious conditions. Heart diseases, like congenital heart defects or heart failure. Lung diseases, like chronic obstructive pulmonary disease, lung cancer, cystic fibrosis, or gastrointestinal disorders, like inflammatory bowel disease. 6. Brittle or cracked nails. What it indicates. Brittle nails that easily break or split can be a sign of malnutrition, dehydration, or insufficient moisture. Serious conditions. Thyroid disease, hypothyroidism, iron deficiency, or vitamin deficiencies, such as biotin or vitamin E. 7. Spoon-shaped nails, koilonychia. What it indicates. This condition is characterized by nails that are concave or spoon-shaped. Serious conditions. Iron deficiency anemia, hemochromatosis, or heart disease. To keep nails healthy and prevent damage or changes that could indicate underlying health issues, proper nutrition and care are essential. Both natural nutrients and man-made supplements can help nourish and strengthen nails. Here's a breakdown of the nutrients that are important for nail health. 1. Biotin, vitamin B7. Role. Biotin is a B vitamin that plays a critical role in maintaining healthy nails, hair, and skin. It helps in the production of keratin, the protein that makes up your nails. Sources: eggs, almonds, spinach, sweet potatoes, avocados, and whole grains. Man-made. Biotin supplements are commonly used to support nail health and can improve nail strength and prevent brittleness. 2. Vitamin A role. Vitamin A helps with cell growth and repair. It's essential for the maintenance of healthy skin and nails. Sources: carrots, sweet potatoes, spinach, kale, and liver. Man-made. Vitamin A supplements can support healthy nail growth if you're deficient. 3. Vitamin Crole. Vitamin C is crucial for collagen production, which helps in the growth and repair of tissues, including nails. It also supports the immune system, preventing infections that could affect the nails. Sources: citrus fruits, strawberries, bell peppers, broccoli, and tomatoes. Man-made. Vitamin C supplements help boost the immune system and promote nail growth. 4. Vitamin E role. Vitamin E is an antioxidant that helps protect the nails from oxidative stress and damage from free radicals. It also supports blood circulation to the nail beds. Sources: almonds, sunflower seeds, spinach, avocados, and sweet potatoes. Man-made. Vitamin E oil or supplements can help nourish the nails, particularly when applied topically. 5. Iron role. Iron helps with oxygen transport in the blood. A deficiency in iron can lead to brittle nails and can cause them to become spoon-shaped. Koilonichia. Sources: red meat, chicken, lentils, spinach, and fortified cereals. Man-made. Iron supplements can be beneficial for people with iron deficiency anemia, which is linked to nail health issues. 6. Zinc role. Zinc is essential for cell division and growth, which is important for healthy nail growth. It also helps in the repair of tissues and strengthens nails. Sources: meat, shellfish, legumes, seeds, and nuts. Man-made. Zinc supplements can support nail growth and prevent nail thinning or brittleness. 7. Protein, keratin, role. Nails are primarily made of keratin, a protein. Adequate protein intake is essential for strong and healthy nails. Sources: meat, eggs, beans, legumes, tofu, nuts, and dairy products. Man-made. Protein supplements like collagen peptides or keratin supplements may promote stronger nails. 8. Omega-3. Fatty acids role. Omega-3 fatty acids nourish nails and improve blood circulation, leading to better nail health. They also prevent dryness and brittleness. Sources: fatty fish, like salmon, mackerel, and sardines, flax seeds, walnuts, and chia seeds. Man-made. Omega-3 supplements, like fish oil, can help maintain hydration in the nails and promote nail growth. 9. Calcium role. Calcium strengthens nails and helps maintain their overall structure. It is crucial for healthy bones and nails. Sources: dairy products, milk, cheese, yogurt, fortified plant-based milk, almond, soy, leafy greens, and fortified cereals. Man-made. Calcium supplements can help if you're not getting enough from food. 10. Magnesium role. Magnesium plays a role in protein synthesis and the formation of keratin. It also helps with calcium absorption, which is vital for nail health. Sources: leafy greens, nuts, seeds, whole grains, and legumes. Man-made. Magnesium supplements can help support healthy nail growth. 11. Sulfur, MSM, methyl sulfonyl methane role. Sulfur is an important component of keratin, and it helps maintain nail health by promoting stronger and faster nail growth. Sources: garlic, onions, cruciferous vegetables, like broccoli and cabbage, and protein-rich foods. Man-made. MSM supplements are often used for joint health, but they also support healthy nails. 12. Folate, vitamin B9. Role: folate is essential for the production of red blood cells, and its deficiency can lead to brittle nails and other skin issues. Sources: leafy greens, legumes, nuts, seeds, and citrus fruits. Man-made. Folate supplements can help prevent deficiency and maintain healthy nails. 13. Collagen role. Collagen supports the structure of nails and skin. It improves the elasticity of nails and reduces the risk of nail breakage. Sources: bone broth, fish skin, chicken skin, and egg whites. 14. Silica roll. Silica helps in the synthesis of collagen and improves the strength of nails. Sources: cucumbers, bell peppers, leafy greens, and whole grains. Man-made. Silica supplements, such as those containing horsetail extract, are commonly used to strengthen nails. Tips for nail health: hydrate. Keep nails moisturized using oils like jojoba or coconut oil. Avoid harsh chemicals. Minimize exposure to harsh chemicals, nail polishes, and removers that can weaken nails. Protect nails. Wear gloves when doing chores to prevent damage from water or cleaning products. Avoid nail biting. This can cause damage to the nail bed and affect growth. By incorporating these nutrients into your diet and considering supplements where necessary, you can help nourish and strengthen your nails, keeping them healthy and resilient. If you're unsure whether you're getting enough of these nutrients, it's always a good idea to consult with a healthcare provider. You said, nail polish, gel nails, and artificial nail enhancements are generally safe when used correctly, but they can pose health risks, especially with frequent or improper use. Here is an overview of potential health concerns related to these nail treatments. 1. Nail polish potential risks. Chemical exposure. Some nail polishes contain harmful chemicals like formaldehyde, toluene, and dibutyl phthalate, DBP, which are associated with skin irritation and respiratory issues, particularly when applied frequently or in poorly ventilated spaces. Skin irritation. Some people may experience allergic reactions, redness, or swelling around the nail bed or cuticles from prolonged exposure to certain ingredients in the polish. Prevention. Look for 3 free or 5 free nail polishes, which are free of toxic chemicals. Also avoid nail polish that contains formaldehyde, which can be a skin irritant and carcinogen in large amounts. 2. Gel nails potential risks. UV light exposure. Gel nails require curing under ultraviolet, UV light, which can increase the risk of skin damage and aging. Frequent UV exposure may increase the risk of developing skin cancer over time, though the risk is low with occasional use. Nail damage. The process of removing gel nails can be damaging to natural nails, especially if done improperly, e.g., peeling off the gel or using harsh acetone. This can lead to thinning, brittleness, and weakness of natural nails. Infections. If the gel nails are applied incorrectly, or if the nail technician doesn't follow proper hygiene, there is a risk of fungal or bacterial infections under the nail. Prevention. Use a broad-spectrum sunscreen on the hands to protect the skin from UV damage. To minimize nail damage, avoid peeling or pulling off gel nails, and always have them professionally removed. The nail bed is the soft tissue underneath the nail plate that plays a crucial role in nail health and growth. Damage to the nail bed can lead to pain, infections, or long-term nail deformities. Several factors can affect the nail bed, including nail enhancements, like gel nails, acrylics, or nail polish, trauma, and health conditions. Common issues affecting the nail bed. 1. Trauma and injury causes. Accidental crushing or hitting the nail, e.g., slamming it in a door, sports injuries. Frequent use of artificial nails, acrylics, gel nails, that cause excessive pressure on the nail bed. Biting or picking at nails. Symptoms: pain, swelling, or bruising, subungual hematoma. Lifting of the nail, onycholysis. Deformed or ridged nails as they grow out. Treatment. For minor injuries, keep the nail clean and protected. If the nail is lifted, avoid pulling it off and let it fall naturally. In severe cases, e.g., blood clot under the nail, a doctor may need to drain it. 2. Nail bed infections, causes, bacterial infections, staphylococcus. Fungal infections, onychomycosis, from moisture trapped under artificial nails. Poor nail hygiene or improperly sterilized nail tools. Symptoms: redness, swelling, and pain around the nail. Pus or fluid discharge. Nail discoloration: yellow, green, or black. Treatment: topical or oral antifungals for fungal infections. Antibiotics for bacterial infections. Keep nails clean and dry. Avoid excessive artificial nail use. 3. Nail lifting, onycholysis. Causes: repeated trauma from artificial nails or manicures. Fungal infections. Psoriasis or other skin conditions. Symptoms: nail detaching from the nail bed, creating a gap. White or yellow discoloration. Treatment: keep nails short and clean. Avoid harsh chemicals and excessive nail polish use. Treat underlying fungal or skin conditions. 4. Poor circulation and nail bed. Health causes: heart disease, diabetes, or vascular conditions. Frequent exposure to cold temperatures. Symptoms: pale or bluish nails. Slow nail growth. Treatment: improve circulation with regular exercise and massage. Manage underlying health conditions. How nail enhancements affect the nail bed. Nail polish and gel. Nails can cause nail bed dryness and brittleness if used excessively. Gel nails require UV curing, which may lead to skin damage around the nail bed. Acrylic and artificial nails can weaken the nail bed if applied frequently or improperly. Increase risk of infections if moisture gets trapped between the fake and natural nail.
3. Artificial nails, acrylic, or other enhancements. Potential risks. Nail damage. The application and removal of acrylic nails can cause significant damage to natural nails, including thinning, breakage, or peeling. This is especially true if the nails are not properly cared for or if the application is done improperly. Infections. Acrylic nails can trap moisture between the nail and the enhancement, which can encourage the growth of bacteria or fungi. If the artificial nails are damaged or if there's a gap between the acrylic and the natural nail, it increases the risk of infection. Toxic fumes. Acrylic nails often use strong adhesives and solvents that can release fumes. Frequent exposure to these chemicals, particularly in poorly ventilated environments, can cause headaches, nausea, or dizziness. Prevention. Ensure that artificial nails are applied and removed by a trained professional to reduce the risk of damage and infection. Always let nails breathe by removing artificial nails periodically, and keep the area clean and dry to avoid infection. 4. Other considerations for nail enhancements. Nail fungus. Wearing artificial nails for long periods without allowing the natural nails to breathe can increase the likelihood of fungal infections, especially if the nails are not removed correctly. Allergic reactions. Some people may develop allergic reactions to the materials used in gel or acrylic nails. Symptoms could include redness, itching, or swelling around the nail bed. Underlying nail conditions. If you have any pre-existing nail conditions like psoriasis or fungal infections, these treatments may worsen the problem or make it harder to treat. General tips to minimize risks. Take breaks. Give your nails time to breathe between treatments to avoid weakening or damage. Choose quality products. Use safer, less toxic products, and opt for 5 free or 7 free nail polishes and gels that exclude harmful chemicals. Seek professional care. Have artificial nails or gels applied and removed by professionals who avoid damaging the natural nails. Use sunscreen. When getting gel nails or manicures that require UV light, apply sunscreen on your hands to protect against UV rays. Proper removal. Never peel off gel or acrylic nails. Always use proper removal techniques, such as soaking them off with acetone, to avoid harming your natural nails. In summary, while nail enhancements can be safe when used correctly and occasionally, frequent or improper use may lead to various health concerns. Ensuring proper application, removal, and care can help reduce the risks to your natural nails and overall health.